know might suffer from such an illness, and how can you support them? How can you early identify and support them? Because early identification, specifically for these disorders, does make a difference in the management. My name is Dr. Amir Zarsani. I'm a pediatrician. Know if someone you know is I'm a pediatrician and working at the teen clinic, and I will be moderating the session today. And I mentioned earlier that we will be joined by a group of an expert, as you can see on the first slide. We would love to hear from you, so if you have any questions, please send them through the Q&A section, and we will try to answer most of the questions by the end of the presentation. There will also be an Arabic session at 2 to 3 p.m. today. So if you know anyone who might be interested in joining that, so please send them the link to that. We'll go through just an outline about what are we going to talk about today. So we're going to talk about the two most common eating disorders, anorexia and bulimia. We'll talk about risk factors, protective factors. We'll talk about healthy nutrition for eating habits in growing teens. We'll talk about the treatment option that we have here in the clinics, tips for parents as well. And then at the end, we'll talk about some of the misconceptions that we usually hear about eating disorder, and we'll go through them and answer some common questions as well. So I hope that you will be enjoying this session. Our first speaker for today is Shayla Al-Shibli. Shayla is a psychologist with expertise in eating disorders. She will be talking about an overview, definition of eating disorders, how to identify it, what are the risk factors, and what are the red flags that you need to pay attention to.
Good morning. Thank you all for joining us today. So today I'll be talking about anorexia nervosa and bulimia nervosa. So to be diagnosed with anorexia nervosa, the 3 following criteria must be met. So it's a restriction of food intake leading to weight loss or a failure to gain weight, resulting in significantly low body weight of what would be expected for somebody's age, sex, and height. They also have this intense fear of gaining weight or becoming fat. And a third criteria is a disturbance in the way in which they view their body's weight or shape. So, for example, a person may think that they are overweight when actually they are underweight, or they believe that they will gain weight just from eating one single meal. A person with anorexia might also not believe that there is a problem with being at a very low body weight, which at this point can make it quite difficult to treat. Next up is bulimia. So you have to fulfill the 4 criteria must be met for an overall diagnosis of bulimia. So eating large amounts of food in the same amount of time as other people, a sense of lack of control over eating during this episode, so they will continue eating even though they may be full. This leads to compensatory behaviors, which include, so the compensatory behaviors they start participating in order not to gain weight from their binging episodes. So this includes self-induced vomiting, a misuse of laxatives, and over-exercising. The 4th criteria is a disturbance in the way in which one's body weight or shape is experienced. So for a clinical diagnosis of bulimia, both binge eating and compensatory behaviors must occur for a minimum once a week. It can obviously happen more than that, over a period of 3 months. So what are the predisposing factors to developing an eating disorder? So this is actually a very common question that we get in our clinic is, how did it start? Where did it start? So there are risk factors that we need to look into and take into account. So if we look at the biological risk factors, somebody or a young person developing an eating disorder is at increased risk of developing the eating disorder if they have a close relative who's already been diagnosed with an eating disorder, if they have a close relative that has or has been diagnosed with a mental health disorder, they have an overall history of dieting, or type 1 diabetes. The other risk factors that we need to consider as well are psychological ones. So those that have a very perfectionist personality trait. So they're very high achievers. They set very high standards for themselves. They have a personal history of an anxiety disorder, and their behaviors and their sort of the way that they think are quite rigid. They don't like too much change. So, for example, a young person might have a very fixed routine that they stick to every day, and if their routine is not, if they adhere to, kind of throws their day out of sync. And the third predisposing factor includes social media, which we're seeing obviously quite a lot now, what with Snapchat and Instagram on the rise, weight stigma, and teasing or bullying. And teasing or bullying can actually happen at home and at school among their peers. So as a parent or as a guardian, what should you be looking out for that may indicate that your young person has an eating disorder? So dramatic weight loss is one of the very big signs. You may also find them dressing in layers, so maybe hoodies or very baggy jumpers, to be able to hide their weight loss and also to stay warm. So if your young person is wearing a hoodie or a jumper in our 50-degree heat that we have here, that may be a very good indicator. They're quite preoccupied with weight, food, calories, and dieting. So you might take them, let's say, to the supermarket and find that they're checking the back of the package or tin, looking at the calorie count and the other nutritional value in it. They start to refuse to eat certain foods, which goes on to progressing into restrictions against whole categories of food. So, for example, restricting carbohydrates. But they might come out and say things initially with, I want to be more healthy. So to be more healthy, I'm going to cut out, white bread, rice, and potatoes. And then it just transitions on from that too. They might make frequent comments about feeling fat or feeling overweight, even though they've lost some weight. They deny feeling hungry. So because they deny feeling hungry, they tend obviously to start avoiding meals and meal times with families or with friends. They may also cook or bake for others, but not eat it themselves. They also start withdrawing from their friendship circles and activities that they used to really enjoy. And you find that they become more isolated and withdrawn and quite secretive. So just to touch on the other point I made about avoiding meal times, they might say things like, oh, I'm really busy. I've got a lot of schoolwork to do. I'm going to eat in my room. So they start taking the food up to their room. However, no one's actually seen them eat. So you might find it, sometimes under the bed. We've had some parents find it in the pockets of their children's clothes. So it's always a really nice idea to have, family meals and ensure that they eat around other people. They also might seem concerned about eating in public. So once we help parents and support parents feed their young person or their child at home, it's very different for them to eat difficult for them to eat their snacks while at school. And the most common issue is, I don't like people watching me eat. So that's sort of, we gradually expose them back into that environment again, because obviously eating among others is normal. You may also find that they spend quite a long time in the bathroom right after their meals. So again, if you notice these types of behaviors, just keep in mind that they might be purging, they might be throwing up their food. So we always recommend that you keep your child around for a minimum of half an hour to up to an hour after a meal, because if they were to purge afterwards, most of the food would have been digested by then. So for young women that have started menstruating, you might find that with this dramatic weight loss that their periods actually stop. They might complain that they're finding it very difficult to concentrate. You might also get feedback from the teachers as well, saying that, this is a new development. They was used to be able to concentrate and focus quite well. However, all of a sudden, it's a little bit more difficult for them to focus. They might complain of feeling dizzy or actually faint as well. You may hear complaints of feeling constipated, abdominal pain. They really don't like the cold. Again, so I go back to them wanting to wear, thick cardigans, hoodies, jumpers. They may complain, or you may notice that they're not as active as they used to be. So they might stay in bed for longer. They might only want to sit on the sofa. They tend to develop sleep problems, so it may take them quite a while to fall asleep. And then once they do fall asleep, they're woken up multiple times during the night, so it becomes disrupted. They can develop dental problems, we see this specifically in those who have been diagnosed with bulimia, because once they purge all their food, the acid from their stomach comes up and starts to erode the enamel on their teeth. They may have dry skin. You might start to see or witness hair loss, or they might stop complaining about it. You may also see bruises and cuts on their knuckles from where they put their fingers in their mouth to make it easier for them to throw up. And the other red flag that you need to look out for is over-exercising. So that may be anywhere from an hour and a half to 2 hours or more a day of exercising. So these are the types of behaviors that may help us identify or may help you identify that your child may have developed or be developing an eating disorder. So thank you very much. I would now like to introduce my colleague, Adba. So Adba Al-Safi, she is a senior clinical dietitian with expertise in the field of eating disorders. She'll be speaking about healthy nutrition and eating habits for our growing teenagers. Thank you.
Thank you, Shayla. Sorry. So my name is Adba Al-Safi. I'll be talking about the healthy nutrition and eating habits for growing teenagers. So teenagers need extra nutrients to support bone growth, as 90% of the bone are formed by the age of 18. Also, internal organs, including the brain, needs extra energy to be able to function in a normal way. Also, teenagers would need extra energy for their extra physical activities. Now we're going to talk about the importance of micronutrients and macronutrients to support healthy bone. So the important nutrients are calcium, vitamin D, and protein. So sources of calcium are dairy products, tofu, soybeans, almond and chestnut, green, dark vegetables, and also orange. Sources of the vitamin D is some fish such as salmon and tuna, egg yolk, dairy products, mushroom, and caviar. So now talk about protein. Why protein is important is because it will help your body to repair cells and make new cells. It will improve your immunity and also for growth and development. So for example, your hair is made from protein. If having inadequate protein intake will cause the thinning of the hair and also falling out of the hair. So the main sources of the protein are animal products such as red meat, chicken and eggs, seafood, beans and lentils, and also tofu has a protein. Now we're going to talk about iron. Why iron is important is because teenagers have increased needs of iron. This is because they have increase in muscle mass and a greater blood supply, also due to the loss of iron during the menstrual cycle. So as iron deficiency, it will cause headache, fatigue, behavior disturbance, decrease in concentration, and also a decrease in the immune function. So the main sources of iron is red meat, including the organs such as liver, dark leafy vegetables. Also, dried fig and dates also contain iron. Now we're going to talk about carbohydrate. So carbohydrate is one of the important micronutrients. Why it's important? Because it will provide energy for the internal organs. Also, the brain only relies on the energy coming from the starch, and also to provide energy for their daily activities. So the main sources, that's all type of grains, all type of the beans, corn and potato, all they have a good source of carbohydrate. Fat is also important, just because it will hold the organs into position. It will help in digestion and absorption, especially the fat-soluble vitamins. It will slow down the digestion, and also it will protect against any trauma injury. So the main sources of fat are nuts, coconut, fish, and avocado. So now we're going to talk about this, the plate. So this is what the healthy plate looks like. So half of the plate should be coming from vegetables or a mix of vegetables and fruits. The other portion will be divided into two. Half of the portion should contain carbohydrate and the other portion contain a protein. So on average, it's the requirement for the healthy teenagers. They should be having at least 5 to 8 ounces from the carbohydrate, which is distributed throughout the day. So for example, the 1 ounce is equal to 1 toast, half cup of cooked rice or pasta. It's recommended for the protein to have about 5 to 6.5 ounces per day. So the 3 ounce is equal to the same size of the palm of the hand. For dairy products, it's recommended to have 3 servings per day. So for example, 1 cup of milk is equal to 1 serving. For the fruits, it's recommended to have 2 to 3 cups per day. I mean, 2 to 3 servings of fruits per day, and vegetables is 2 to 3 cups per day. So this is the average requirement for healthy teenagers. This requirement varies. It depends on the gender, the age, and the current weight and the height, and also depends on the current activity level. So the hand is a good guideline that can be used to have an idea about the portion sizes for each food groups. So for example, the 90 grams of protein is equal to the same size of the palm of the hand. 2 tablespoons of peanut butter, for example, is the same size of the thumb. The fist of the hand is represent the 1 cup of cooked rice or a regular size of fruit. So now talking about importance of breakfast, because breakfast is one of the meals that usually teenagers skip. So it's very important for them to understand that breakfast is important because it will help them to improve in the school performance, to improve the energy and concentration level throughout the morning, and also it will help in maintaining healthy weight. Lastly, we're going to talk about fluid requirements. So it's recommended to drink 6 to 8 glasses per day to prevent any dehydration, because any mild dehydration will lead to headaches, irritability, and loss of concentration. So in conclusion, it's very important to have a variety of food from each food groups. Breakfast is very important meal. Having said that, it's very important to have 3 main meals and about 2 to 3 snacks per day. And also, it's important to stay hydrated. Thank you. Now, we're going to introduce the last speaker for today is Dion Sears. She is a social worker with this experience in the treatment of eating disorder and family therapy. She'll be talking to us about the treatment available currently for children and teens who are struggling with eating disorders. Thank you.
Thank you, Atba. So far we've had a chance to talk about the major types of eating disorders, as well as heard about nutrition options. We're going to wrap up the webinar today just looking at treatment options that are available. So treatment for eating disorder typically includes a combination of interventions. These interventions are aimed at supporting both the physical and the mental health of the young person, as well as supporting the family that is taking care of that young person. It includes a combination of medical, nutritional, and psychological counseling. From medical monitoring, you can receive treatment both in the outpatient setting as well as the inpatient setting. And inpatient is usually recommended when the young person is not able to obtain all their nutritional intake as an outpatient treatment. Nutrition education is available throughout the course of treatment, and it's offered to families to support them as they continue to feed the young person until the young person is able to feed him or herself. Psychotherapy is also another layer of treatment that's available. And this is usually activated when the young person is medically stable and able to really engage in therapy sessions. The sessions are aimed at helping to decrease the eating disorder thoughts, as well as helping the young person develop coping strategies and techniques to manage some of the behaviors that are associated with the illness. Medication is also one of the options that's available, and this is usually introduced as an added support. It's important to know that their medication does not cure eating disorder, but is targeted at the behaviors and the symptoms that are associated with illness. Medication can be used as a short term, so within the 6 months range, or it can be longer term, greater than a year. And it all depends on how well that young person is responding to treatment. So we're going to now look at how to support. What does support look like, especially around meals, because the goal when someone is struggling with an eating disorder is to get them to eat. So we're going to look at the planning stage, we're going to look at the meal preparation stage, and then we're going to look at what happens during the meal, and then how do you support after the meal, okay? So lack of structure and predictability can cause a lot of stress for young people with eating disorders. When they don't know what is being served, they might worry about how it's being prepared and what is going to be offered. Therefore, planning meals and snacks well ahead of time can help lessen this anxiety and decrease stress. It also helps to decrease the eating disorder thoughts that are associated with the illness, and it lessens arguments around meal times. So it's really important for you to plan meals several days in advance. You want to also get the young person involved in the planning stage, but it still can be a bit overwhelming for them. So what is recommended is that you offer them minimal choices. So for example, if we're talking about dinner on Wednesday night, you may tell them, okay, your protein options for Wednesday night dinner is fish or chicken. Which one would you like? So you offer them minimal choices, but you also engage their participation. You want to be as specific as possible when you are planning meals and snacks. What I mean by that is you want to address who is going to be preparing the meal, what is going to be offered, what time is it going to be offered, and where is it going to be done. Are we going to be eating at our house tonight, or are we going to be eating at grandma's house tonight? Being specific helps decrease the anxiety. And the reason that we truly want to plan meals and snacks ahead is because it ensures that the young person gets sufficient nutrition and adequate nourishment. So in addition to planning ahead, meal preparation is also very important. Now, young people experience a lot of fear when they don't know what is inside meals. It often results in arguments, and they very much want to be involved in the cooking, like my colleague Shayla shared earlier. They want to cook, they want to serve, but this can still be stressful for them, and it also can be very disruptive for the caregivers as they're preparing meals. So it's important for you to set some ground rules around meal preparation. One of the first rules is no negotiations. So you've been feeding your child for many years now. You've been cooking those recipes for a really long time. So you know what the ingredients are, you know what the meals are required. So no negotiation around how you're going to be preparing that meal. The meal gets prepared and the recipe gets followed the same way it's been followed all along, right? So one of the first rules is no negotiation. Some families also find it's very helpful to remove the young person from the kitchen because it is less stressful for them and also less disruptive for the parents or the caregiver. We also want to avoid measuring. Now, what I mean by that is not that you don't measure when you're cooking recipes, but when the food is done, being prepared, and you are serving the food, you want to avoid using measuring utensils during the time. My colleague Akba talks about using the palm of your hands as ways to estimate proportions. So we try to encourage that a little bit more rather than using measuring tools, because the young person can become fixated on specifically 1 cup of ABCD. So in addition to avoiding measuring, we want to also avoid diets and low-fat products. Again, this is part of normalizing sufficient nutrition across the board and different food options. And lastly, the most important piece with regards to meal preparation is the caregiver decides the portion sizes. You've been feeding your child for a long time, you know what he or she needs, and therefore when it comes to the quantity of what he or she needs to be eaten, you're the one who gets to make the final decision about that. So families and caregivers play a critical role in how meal times are structured, and family meals are very essential. The approach used during meal times has a big impact on the mood and the behaviors that the young person has. So we want to encourage family meals as often as possible. And it's not optional for your child to participate. But you also want to try and create an environment around the dinner table in which it is not stressful. So you want to avoid talking about sensitive topics like food and weight and looks during meal times. As a family, you want to engage them in other conversation about their day or current events or other topics that they may find interesting as well. Now, after meals, for some youths, they find the time after meal to be even more stressful than eating the meal itself. They may feel physically unwell because they've eaten a larger portion than their bodies are used to. And in addition to that, the eating disorder thoughts can surface and become even stronger. Oftentimes, these young people will feel a lot of guilt and regret for eating. And they may choose to manage these symptoms in unhealthy ways, such as purging, which was discussed earlier. So to prevent these types of behavior, it's really important for you to use distraction. Now, distraction is very similar to what we were just talking about, in which you are engaging their thought process. So whether you sit down and do a board game with them, or whether they help you clean up after dinner, or whether you sit and watch a movie together or read a book together, the purpose is for you to supervise, so spend time with them for about 30 to an hour after that meal. It gives the meal time to digest, but it also helps them to be engaged and therefore decreases the eating disorder thoughts. The time frame that we usually target is about 30 minutes to about an hour. And over time, those thoughts lessen the more you spend that time with the young person, engage in activities that they find interesting. So encouraging activities that is not linked to food, not linked to weight, can be very rewarding for these young people. So you want to help them support their new skills, whether it's an area that they're trying to develop, whether they're taking care of a pet, whether they want to volunteer. You want to engage in activities that are not related to appearance. And it also provides an opportunity for you to spend some quality time with your young person. Your child might be interested in a particular video game that you don't find interesting at all. But if you sit down and join with them, that's an opportunity for you to engage them in activities that are not related to food and weight as well. So now we're going to talk about some takeaway tips that can be overall helpful if you are concerned about your child's behaviors around food. So we need to remember that we are our children's role models. So they're looking at every move that we make. They're very conscious of what we're saying, how we respond to our bodies, what we say about food, the comments that we make about other people's looks and foods as well. So we as caregivers and parents need to be very mindful with how our own behaviors and the things that we say, because it can trigger them, right? So we want to avoid, for example, speaking critically about your child's weight and look, or appearance as well. And then it's important for you to praise your child's accomplishments and the things that he or she is doing well, rather than their appearance or their looks as well. Paying attention to your child's behaviors and food intake is also important. And this is the reason that I stressed earlier the importance of family meals, because family meals allow an opportunity for you to do so, for you to be able to see how they're relating and responding to food. It's really important. We spent the last this webinar looking at signs and red flags for developing eating disorders. So it's important for you to remain alert about these signs. And when you do see signs that are uncomfortable or signs that makes you wonder if something is going on, don't hesitate to speak to your youth about it. If you don't know how to engage them in the conversation, seek help so that you can be guided as to how to start having the conversation with them. The most important piece is if you see anything that's concerning, you reach out to us for help, reach out to professionals who can guide you. A lot of the tips that we talked about today can help minimize the symptoms that are associated with eating disorder. They can also help you catch any emerging eating disorder problems early. Thank you for joining us today. I'm going to hand over to Dr. Ellen Nude, who will facilitate the question and answers.
Thank you, Dion. And I would just like to thank all the presenters again for joining us today and sharing their expertise with us. And thank you all for taking the time to join the webinar today. While we're waiting for questions to come in, we will be talking about some of the common questions that we hear about in the clinic and some of the misconceptions basically about eating disorders. The first one would be, so are eating disorders a choice? No, eating disorders are not a choice. The young child or the teen does not choose to have an eating disorder. It's a disease, just like any other illness. Do parents cause eating disorders? No, they don't. Parents are a very important part of the management plan, and so their help and support is required to help their child get through this hard period of time, and they never cause an eating disorder. Doesn't everyone have an eating disorder these days? Well, there are disordered patterns of eating, which are very common that we do see, but it doesn't all translate to clinical eating disorders. So eating disorders in general are less frequent than disordered pattern of eating. Are eating disorders really that serious? Yes, because eating disorders have the highest mortality rate of any other psychiatric illness. And so that's why we've been talking about early identification and management, because it does prevent some of the unwanted long-term complications. Aren't eating disorders a girl thing? Eating disorders can actually affect anyone, regardless of their gender or age or race or ethnicity or background. Can someone be too young or too old to develop an eating disorder? No, they can develop and they can occur and reemerge at any age. So there are no age that are, like, it's not more common in age than the other. You can see it in children, you can see it in adolescents, you can see it in adults. So it does happen and occur in all age groups. Okay, so again, while we're waiting for the question, I just wanted to mention that if you think that you have someone with an eating disorder or someone who's struggling with their eating habits that you want to be checked, referrals to the clinic are done through a healthcare professional. So we do advise that you take your child to be checked by a primary healthcare physician or in a private clinic or even in the emergency room if you're really concerned. And then they will refer those cases to us if needed. But if you also have any questions about any of the topics that were presented today, please email us on the clinic email, which is teamclinicteam@sidra.org, and we'll make sure to get back to you with your inquiries. Let's see if we have anything. Okay. There was a question about the treatment. So the treatment for eating disorders and who gets to be seen by whom. It's actually so it's a team of clinicians and healthcare providers, because eating disorders are they present in multiple ways. And so the team that takes care of these patients, so we have medical professionals, because eating disorder has lots of medical complications. We have, as you've seen from today's presentation, we have our family therapist who's a social worker, which is the main treatment for eating disorder. We have a psychologist as part of the team, and that's to assess if we have some other comorbid conditions in addition to the eating disorder. Our dietitian is always here to support us, figuring out where are we in terms of a healthy weight range and how can we reach that in a healthy way. The team also has a nurse who gets the child and the adolescents to be weighed in to make sure that we're continuing to progress. And so it's actually a multi-disciplinary team, and it's not only one person, given the complexity of these conditions.
I wanted to know common causes.
Okay. Let's see. There was a question on YouTube about what are the most common causes of eating disorder. So there are no single identified cause for these conditions. There are genetic predispositions. So if there's, as we mentioned earlier during the presentation, if there's a family history, there is a reported increased incidence in the cases of eating disorders. And then there is the effect of society pressures as well on leanness, and it being a sign of being beautiful, and that pressure that is put on children and adolescents. And then there is also a frequent history of dieting, as we've talked about also in the presentation. That's a predisposition to developing an eating disorder, but there's no single cause that we can say that this has caused an eating disorder. Sorry. We have another question on YouTube. What is it? How do you work with schools regarding eating disorders? At this point, the only thing that we've been able to do was to connect with, so if we have patients in the clinic, we connect with our counselors at school to make sure that we're providing the best care possible for the young child to help and support them while they're at school as well. And also that school helps us implementing our treatment plan and works with us and with the family. So schools are an integral part. The other thing is the referrals for these patients. So referrals, we've been getting referrals from schools about their suspicion of someone who has an eating disorder for them to get support. The only thing is that referrals has to go through a healthcare professional before they get to us. But we're also available if you have any questions. So if anyone has any questions about how to get to the clinic in the future, or if they just have any questions about a young child that they have at school, they can email us on the clinic email, and then we can provide them some kind of support and guidance until the young person is seen if needed. What types of medications? Okay. And if there are any other questions, just let me know, because I can't access the Q&A. There was a question about medications and what type of medications are used, and if these medications are used to target the eating disorder itself or treat the eating disorder itself. We do use medications sometimes as a support and as an addition to the management plan if we identify that there are other comorbid conditions. So there are no single medication that targets the anorexia or the bulimia itself. The treatment for that is family-based therapy and psychological therapy, nutritional support, and medical monitoring. But if we identify that the young child or the adolescents have some other comorbid conditions that we need to get in control in order for their eating disorder to improve, then we do recommend starting that as well. Types of medication that we might be using include antidepressant, antipsychotic medications, something to help with the anxiety as well. In addition to other supplements and vitamins that we do recommend for the young child until their nutrition gets on the right track. I think we're done with the questions. There are no more questions coming in. I just want to remind everyone about the Arabic session that will be occurring from 2 to 3 p.m. today. If you know anyone who's interested or would like to join, we will have almost the similar type presentation talking about the common causes, the common cases of eating disorder and its causes. Thank you all again for joining us. We look forward to welcoming you in our future sessions.